Well, good afternoon. We have to protect people, and we have to protect their livelihoods. And the best way we can protect our economy is protecting people and keeping this virus contained. When this crisis hit, we had to act quickly. We provided unprecedented funding for healthcare. We invested $7.7 billion alone this year since launching Ontario's Action Plan in March. That's $7.7 billion to support our frontline healthcare heroes, increase hospital bed capacity, open schools safely, and protect our seniors. We're also there for Ontario businesses, families, and workers who felt the impacts of this terrible virus. We provided $11 billion to support people and jobs. We put $200 per child, $250 per child with special needs in the pockets of over 1.5 million Ontario families. 194,000 low-income seniors across Ontario saw their guaranteed annual income system payments doubled. We provided $176 million in savings by offering discounted off-peak electricity pricing 24/7 until May for families, small businesses, and farms. And we provided another $11 billion in supports for people and employers to keep more money in their pockets when they needed it most, including tax deferrals, WSIB premium reductions. We banned commercial evictions, and we worked with our federal partners to set up a commercial rent relief program for small businesses. Almost 64,000 small business tenants and their landlords have benefited from that program. Going forward, we will continue to build on that plan. We will focus on critical priorities while providing the flexibility to respond to any scenario. The upcoming fall budget will be our roadmap. It will guide us during this period of tremendous uncertainty. Minister Phillips will have some important news to share in a moment. But first, I want to share a message with Ontario's entrepreneurs, small business owners, and businesses of all sizes. We've been listening to you. We've heard you loud and clear. You need more supports. You need more help with fixed costs. That's why we committed up to $300 million to help small businesses in modified Stage 2 regions by covering fixed costs like property tax and hydro bills. But I can assure you, there's more help on the way. And as Premier, I'll make it clear, we're going to continue to do what's necessary to protect people's health and jobs while laying the foundation for a strong long-term care economic recovery. I just don't believe in taxes or increasing taxes as a solution to our problems. We have to be there for our businesses and the people who built them and put more money back into their pockets instead of the government's pockets. We have your backs. We will pull through this together. And when this is all over, we will continue to fire up our economic engine. We will bring more prosperity and more opportunity than ever before to every corner of this province, starting with the solid foundation of Ontario's Action Plan. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Phillips.
Thank you, Premier. When the first wave of COVID-19 started back in March, Premier Ford made it clear that our government would do whatever it takes to protect the people of Ontario and support them through this challenging period. Nothing was more important then, and nothing is more important now. Back in mid-March, as the global health crisis took hold and a state of emergency was declared, it was clear that there was too much uncertainty to put forward a full multi-year budget as we had intended. But it was still important for our government that we remain transparent and accountable to our citizens. That is why Ontario, unique among governments in Canada, presented a one-year economic and fiscal update at the beginning of the pandemic. As we reported in the first quarter finances, this plan makes $30 billion available in response to COVID-19, and it is a model that has been followed by governments across Canada since then. Back on March 25th, we committed to putting forward a multi-year budget by November 15th, and we will keep that promise. On Thursday, November 5th, I will release the next phase of Ontario's Action Plan. It will be a 3-year budget that will build on our government's $30 billion response to COVID-19. We will get back on the traditional budget calendar with another multi-year budget update by the end of March 2021 that outlines a plan to return Ontario to a fiscally sustainable path. By putting forward a multi-year plan next week, Ontario will once again be one of the leaders among Canadian governments, and this is important. Because as any family or small business owner understands, having a financial plan is important, especially when things are uncertain. Now, to be very clear, a great deal of uncertainty remains today. The range in private sector economic forecasts, something that I watch closely as finance minister, is twice as wide today as during the 2008 global financial crisis, and 3 times as wide as in normal times. We will account for this by including 3 plausible economic scenarios in our outlook on November 5th. All of us have learned a great deal about life in a pandemic this year. It would be arrogant to ignore those lessons. We understand more about the virus than we did 8 months ago, and we know more about how people and economies will respond based on the experience of other jurisdictions as well as here at home. We know that surges in cases and even future waves are to be anticipated until we have a vaccine. And we know that people and employers will continue to need support until we are on the road to recovery. One thing we all have learned from this global pandemic is the value of humility, being confident enough to admit what we don't know, but bold enough to learn from our collective experience. Ontario's 2020 budget will look confidently to the future, but it will not presume that any of us have all of the answers. It will be informed by input from over 8,000 people, including employers, labor organizations, not-for-profits, religious and cultural organizations, and our partners in municipal government. It will also build on our successful collaborative relationship with our federal partners. Most importantly, it will make available every necessary resource to continue to protect people's health going forward, and it will expand the support our government has provided to those still facing financial hardship due to the pandemic, including families, workers, vulnerable people, seniors, and employers. Around the world, we can see that others are sharing a similar experience as a result of COVID-19. But it's here in Ontario that the people have shown a unique strength and resilience. The people of Ontario will continue to be there for each other, and we will continue to be there for them. Together, we navigated the first wave. All of us together must work to apply the lessons we learned to successfully navigate the second and beyond. Thank you.
Okay, we'll go to the phone line for questions. First question, please.
First question comes from Haley Cooper at News Talk 1010. Please go ahead.
Hi, Haley.
Thank you. Hi, Premier. You said on Friday that we would be expecting a decision on Halton and Durham regions today, as well as other regions of concern that were discussed over the weekend. So why wasn't that decision made today, and how much of an impact did that open letter from Halton region mayors asking for a targeted approach rather than a blanket approach play?
Well, I'm glad you asked that question, Haley. I'll address that. I had a phone call from Mayor Burton from Oakville. We have a great relationship. Matter of fact, we have great relationships with all 444 municipalities. I've been speaking to our local MPPs, and when Mayor Burton called me and said, hey, I don't think we're at that point. And this is unique, because when it came to Ottawa, when it came to Toronto, when it came to Peel, and it came to York, all the mayors agreed. In Halton, this is unique, because we have none of the mayors agreeing. We have the regional chair not agreeing, have our MPPs not agreeing. So I suggested to write a letter. Write a letter, let your local chief medical officer be aware of how you feel and other mayors feel and our MPPs feel. I spoke to one of my great MPPs, Jane McKenna, and said, I encourage you to write the letter. Somehow, that got twisted around in words in certain local media outlet that we weren't together. Let me be very, very clear. You know, this province, all 444 municipalities, our entire caucus, the federal government, we're all working together. And do we agree on everything? Absolutely not. I've come out here numerous times and said, do we have really good caucus meetings that there's differing opinions in cabinet? Matter of fact, we do. We have a lot of people from one end to the other. We sometimes will go 4 hours on a cabinet or a caucus meeting, but make no mistake about it. We're all in this together. We're all working together. Our number one focus is obviously health and the safety of the people, but right beside that is the economy. There's no one that wants to get this economic engine going more than I do. And I'll give you a story. There's 3 areas. I always reach out to the municipalities because no one understands their municipalities better than the local mayor, MPPs, local councillors, local MPs than they do. They understand their area. Then we work side by side with them. We also reach out to businesses in the area. And the most important thing is I'm out there talking to them. I call it grassroots, talking to the people, and I'll give you a 1-minute story here. And this is about a tobacco business. And I hope he doesn't mind me mentioning it because it's a phenomenal business. It's called Crooked Q. Sam Pappas, I've been there numerous times. And this is a family that's been working their backs off. And I talk to them. I talk to them late at night and listen to them for 30 minutes. People always come up to me, Haley, and they always say, you must be under stress. You must be under pressure. That's nothing compared to listening to the stories of these business owners, no matter if it's a small boutique fitness company or a restaurant called Crooked Q, and I encourage you to go there and listen to Sam tell me about his stories. He's the only guy with a retractable roof that I know of in the entire city. Why can't he open up? I'm fighting for these small businesses. I understand small businesses. I understand what it takes to meet a payroll and how connected you get with your employees that are relying on you to get a paycheck. I get it. I want to get the economy going. I want to open up these restaurants. And so it's all about the people. It's all about these restaurant owners and the small business owners. I've had to meet a payroll before we got into this. I understand what it is to look at a profit and loss statement and how you're going to pay the rent. So my objective is always to protect the health and safety, but get the businesses open. So as I spoke to the Mayor Burton, I encouraged him. I was the one who said, write the letter. Make no mistake about it, our party's united. Do we differ? 100%, but that's healthy. I encourage differing opinions. I've talked to our MPPs. I talked to Parham Gill. I talked to Jane McKenna. And they're 2 of the greatest MPPs I could ever ask for. They're incredible.
Follow-up?
Thank you. And my follow-up, so Premier, during the weekend when you were meeting with your Health Command table, at any point was there a recommendation made that Halton and Durham should be rolled back into a modified stage 2, and then these letters were written and the decision has been put on pause for the time being? Because during this entire pandemic, you've said that you have to listen to the doctors, you have to listen to the science, but now it sounds like politicians are somewhat having a say in what the decision is.
Well, elected officials have always had a say. Every single time we roll back to stage 2, I've contacted all the mayors. I speak to them, and everyone was in consensus. But when they aren't, it's concerning to me. And a priority is to keep the economy going, protect the small businesses, but we also have to keep in mind the health and safety. I always say I got to listen to the docs. I always will, and the science. In saying that, I have to listen to the small business owners, the guys who are struggling, the guys and gals that are struggling out there trying to meet the payroll. And when after getting off, you don't think that weighs on someone's shoulders? I'm not worried about myself on pressure. I'm worried. You want pressure? Try to meet a payroll. Try to keep your business open. Try to pay a mortgage on your house when you aren't having any income or paying rent. That's pressure. I don't have any pressure compared to these business owners.
Next question.
Next question comes from Travis Danrash at Global News. Please go ahead.
Hi, Travis.
Hi there, Premier. It's kind of a broad question,
Sure.
but I think Ontarians are wondering if you can be clear about what the province's strategy is here, and are these shutdowns working, and can you provide evidence that they are, considering this weekend we had over 1,000 cases reported in a single day, and as I know that you're aware, that's the highest number since the pandemic started.
Mm-hmm. And thanks for the question, Travis. And before I pass it over to the minister, these are areas, I just don't wake up or get at nighttime, see the numbers and say, okay, we're in trouble. I check the ICU capacity in hospitals, the capacity in acute care beds, making sure our long-term care is being locked down, making sure that we're hiring more PSW. So there's a raft of things that I get briefed on every day, probably half a dozen times a day, and I'm being conservative, but measuring everything. On top of it, measuring the economic impact, measuring people's health, mental health, and depression, for example. It's not easy when you're trying to meet a payroll and you have no income coming in. But I'll pass it over to the minister. Thank you.
Well, we consider a consistent set of issues every time we are asked to make a decision about whether an area should be moved into a modified stage 2 or not. The first, of course, is going to be the level of cases, the number of new cases we're seeing. Then we also look at the ability of our public health system to be able to deal with that in order to do the testing, tracing, isolation, contact management. We also have to look at our hospital capacity, both in terms of intensive care beds and ventilators available. And then, of course, we consistently speak with the medical officers of health in the particular areas. So what we're seeing right now, since we've put 4 areas into a modified stage 2, is we're also seeing some of the impacts from Thanksgiving several weeks ago. So we've got that adding to the increase in community transmission, but we are also starting to see some of the numbers go down in some of the modified areas. But because of the impacts of Thanksgiving, we're not seeing that happen quite as quickly as we'd like to, but the numbers in some areas are starting to come down.
Follow-up?
Yes, Premier, I have a question from my colleague Mike Roulet at Global National. Are you seeing pushback from regions that you did not see before, and do you think the regions continue to have faith in the decisions being made by the province?
I feel confident. There's always been pushback on all sides, right from the get-go. Travis, we have caucus members, cabinet members on both sides. We have some cabinet caucus members that think, don't worry, everything's fine. We have other ones that may feel okay, shut everything down. But we're going right down the middle of the road. We have to have a happy balance. And it's not easy to make sure that on one hand we keep businesses going. And I just want to give people hope. Last month, there was 168,000 new jobs. Out of that, over 50,000 manufacturing jobs. Matter of fact, and this is a shocking stat, we have more manufacturing jobs than we did prior COVID, with 50,000 new manufacturing jobs. But I give the credit to the people. They're out there being creative, being true entrepreneurs, starting up companies, starting PPE companies, and they play a critical role in it. But it depends on what region. You know, can I justify if a region is hitting super high numbers, be it Peel or Toronto? No, I can't justify. Can I fight all day long for Halton and other regions that are on the brink and cheering them on and really pushing back at the health table? I do it all the time. I do it all the time, but I have to have the balance there.
Next question.
Next question comes from Laura Stone at the Globe and Mail. Please go ahead.
Hi, Premier. I just wanted to go back to the letter that was sent on the weekend. It was sent to Dr. Williams, but you were also copied on the letter, as was Minister Elliott and some others. So can you explain, are you saying that you told your own MPP to send the letter? And can you clarify whether the letter was successful in not having further restrictions imposed on the region?
Well, we don't base it on letters, so that wouldn't play a factor. And yes, I talked to Mayor Burton. I'll just run through it again. He said we aren't ready for a lockdown. I said, Mayor, I don't disagree, but I can't keep playing the pitcher and the catcher. I need your support. If you feel that way, please send a letter over to your local chief medical officer, and you can copy Dr. Williams. Dr. Williams is open to letters, and I said the same thing with Jane that night. I said, by all means, send it out. It's a unique situation when you have all the municipal leaders, provincial leaders, and federal leader all disagreeing with the local chief medical officer. That's a wake-up call for sure, because all the other regions have all agreed. And that's okay. There's nothing wrong with that. They have to fight for their businesses and the small business. They're the people that elect these representatives, no matter if it's municipal, provincial, and federally. And I respect that. 100% I respect that, and I encourage it. If they're doing that in a unique situation, God bless them. At least it gives Dr. Williams and gives their chief medical officer something to go by, because they're the people on the ground. They're the ones walking into the restaurants, going into these small businesses that we need to keep open and keep revenue going into their facilities. So that's what happened, and there's no other part to the story. That's exactly what happened.
Follow-up.
I seem to recall the Ottawa mayor pushing back on the restrictions you imposed on that city. So, you've said you listen to the medical experts. You say that politicians always have a say. So, can you respond maybe to some of the criticisms that you're not fully explaining how and why these decisions come about?
Well, when I talked to the mayor in Ottawa, I told him, and he agreed. And I can't say what he said after because I'm not too sure. But when he gives me the green light and agrees, and then goes out there, days later and disagrees, you're going to ask him why he's doing that. But I can tell you that our conversation was he agreed to move forward with it. And thank goodness that we did with the numbers that we saw coming out of Ottawa. And I understand he's under pressure from his local businesses too. But I just ask any municipal politician when I talk to you, when you give me an answer, don't change your mind the next day or 2 days later. It's very simple.
Next question.
Next question comes from Randy Rath at CHCH-TV. Please go ahead.
How you doing, Randy?
Hi, Premier. I want to ask you today about the situation with Sam Osterhoff in posing for a picture that was all over Facebook, and there have been calls for him to be removed as the parliamentary assistant to the Minister of Education. He basically justified it by saying that he made a mistake at the end of the night and posed in this picture. The owner of the facility where this took place has told us that they had a private room and that several times during the night, the staff had to go in and remind them of the rules as to social distancing. Do you still have confidence in Mr. Osterhoff?
I have 100% confidence in Sam. He does a great job representing his area. People love him out there. And he came out and apologized. Hey, guys, everyone makes mistakes. He admitted he made mistakes. I'm a strong believer. You make a mistake, you go out and apologize and say it's not going to happen again. I accept that. I've made mistakes. I've come out here and I've apologized to the people because I might have quoted something inaccurately. And you move forward. But no, he's a great representative. I'm proud to have him on the team, and he'll continue being the PA to the education minister, doing a great job.
Follow-up.
Okay, thanks. Also, on the weekend, the OPP commissioner released a videotape of two of his officers essentially under attack in their cruiser in Caledonia. The protesters justified this by saying that the officers had been asked to move along previous to this attack. What do you make of that?
Well, it's really, really unfortunate that that's happening. You don't attack our police officers. There's one country, one law, one rule. You follow the law. Simple as that. Violence, I have zero tolerance for violence, and it won't be tolerated. Very simple. It's a clear message. Don't be attacking our police officers. They're there to help you, to support you, to keep law and order. Just imagine if we didn't have the police, there'd be anarchy. And I support our police. And I think it's disgusting someone wants to attack our police. It's unacceptable. They need to be held accountable.
Next question.
Next question comes from Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. Just to get back to the Halton stuff, I'm a little confused. So, did the Halton medical officer say he was in favor of restrictions? And did all this get changed because the numbers changed, or because you got pushback? Because on Friday you were saying that you were very concerned about the numbers.
I'm concerned about all areas, and I say that people have to hunker down. I have to tell the people, make sure we hunker down. We're at that peak, and I guess he heard rumors about Halton maybe closing down, but I was straightforward with him. By all means, contact your chief medical officer. Again, I was the one who told him he should write a letter, put it in writing, and put it over there again with my MPP. It wasn't surprising because I was the one who said, yeah, voice your opinion. I think that's healthy. That's democracy. They're the ones that are talking to the small business owners. They're the ones going in there. And there's nothing wrong with people disagreeing. You know, we're all, everyone's favorite saying, we're all in this together, and we are. But you can't just have one view. You have to look at these businesses, and when you're in there every single day and you're talking to the local restaurant owner or local convenience store owner or whatever business it is, my job is to protect every business in the province, and I'm going to do that. I also have to make sure that everyone's healthy and safe. So it's a real balancing act.
Follow-up?
Yeah, thanks for that. I'm still a little bit confused about whether the medical officer of health was supporting restrictions or not. But anyway, let's move on a bit. So where does Halton stand now? Is Halton still on the bubble? Are you not worried about Halton? And how much higher would the numbers have to go there?
I'll pass that over to the minister. Thank you.
Well, that's something that we're still considering. Halton has been sort of on the edge for a period of time, but any decision that will be made will be based on the medical evidence, based on speaking with the medical officer of health there, and the other elements that I spoke about earlier, the number of cases, the ability of our public health system to be able to follow up with testing, tracing, and isolating, contact management, and so on, as well as our hospital capacity. So there's a number of factors that need to be considered, and Halton will be considered as with any of the other areas that we're concerned about right now.
This will be the last question.
Last question comes from Graham Richardson at CTV Ottawa. Please go ahead.
Hi, Premier. I just want to come back to this suggestion. If I understand you correctly, Mayor Jim Watson in Ottawa told you on the phone or privately that he was fine with new lockdowns. And then I think you said he said something differently a few days later. Are you suggesting that, what are you suggesting?
Well, I'm not suggesting anything. The question was asked, did he disagree? No, he didn't disagree. And I think the world of Mayor Watson. He's doing a great job. We have a great relationship. My point is, I always call the mayors. I always get feedback from the local officials because it's a priority. No one knows the area better than them, and I'm sure no one knows Ottawa better than Mayor Watson, local councillors, local MPPs, and MPs. So I always bounce things off of them, and at the time, as much as I don't like doing this, I always talk to him, and he said, I'm sure he didn't like doing it, but at the end of the day, he took the advice off Dr. Etches in Ottawa, and we moved forward on it. So, and it was the right decision to be made. Again, you got to differentiate between case numbers and capacity in hospitals and transmission rates. There's a wide range, as the minister just mentioned, that you have to take into consideration. It's just not a willy-nilly decision that we look at numbers going up and that's it. We can't do that. And as I've said, when the numbers are low and the hospital capacity is low, I'll fight all day for Halton. I'll also fight all day for any region. But when they get up as high as, let's say, Peel, and we see an escalation, or Toronto, you have to come to reality. Yeah, there's something has to take place here. But when I don't see the numbers, I'm their biggest advocate. I wish some of the business owners could hear our discussions, that I'm sitting there fighting for them and making sure the justification's there. And so far, in those 4 regions, it's there. I can't argue the point. Can I argue the point on other regions that are close? Yeah, and I will all day long, because it's all about supporting the business owners and small businesses and people and jobs. And once we get through this, I can assure people our economy will be on fire. It'll be on fire like we're leading North America prior to this pandemic. We were leading job creation, economic development more than any region in North America. Texas is a big state, and they're really booming back then. Well, Vic Fideli and I, the Minister of Economic Development, went down there, and per capita, we're doing better than they were. So we're going to get back to that point, folks, and the economy will be booming once again. I will pass it to my Minister of Finance.
Thanks, Premier, and thank you, Graham. Yes, and not just through the pre-pandemic, but there's an interesting report I'd recommend to people by the TD Bank that actually profiles the recovery in Canada and Ontario versus the recovery in the U.S. And I think it again, I'd recommend it as reading. It's really what it says is the approach that Ontario and Canada has been taking, which is a very purposeful approach, which says, we remember our 3 stages of opening, and again, in a very considered way, looking at any restrictions that need to be put in, is actually paying off in terms of better return around jobs coming back than we're seeing in, just for one example, south of the border. So this is something that's a key focus that the Premier has said to all of us, that we have to balance, of course, the health and safety of Ontarians, but that health and safety, making sure that our health system is working, making sure that we have the contact tracing, making sure that we are able to do the work we need to do on the health side, is, as we had said it would be, turning out to be the key to a sustained economic recovery. So we'll continue with that plan, and we'll continue to make sure that we're balancing both of those priorities, making sure that we're understanding how the health needs of Ontarians and the safety that Ontarians need to feel about their health system is also something that's going to generate economic growth now and set the foundations for the future.
Follow-up?
Back to Ottawa, Premier, on that point.
Yep.
Of the hot zones, Ottawa's R level is below 1, better than York, better than Toronto. Ottawa's per 100,000 rate, which I know you watched before because it was 70-something and Toronto was 50-something.
That's right.
That has now flipped. Of the 4 hot zones currently modified stage 2, it seems the new restrictions have only worked here. If that trend continues, what about Ottawa businesses in the next 2 weeks? If they hold the line here like they have been, can a return to stage 3 be on the table?
Well, again, if we didn't act quickly, they wouldn't be in that position, and they are, and I congratulate them. They're doing a great job. But this is better answered by my minister.
Well, certainly when I indicated earlier that there are some areas where the numbers are starting to go down, that really is indicative of what's going on in Ottawa. You're right, in some of the other areas we haven't seen those numbers change very much yet, but it's still too soon to say because, of course, we had Thanksgiving activities happening in or around the same time that the modified Stage 2 provisions were put in. So as far as York, Toronto, and Peel are concerned, we're still waiting to see those results and have those numbers start coming down. But Ottawa is doing very well, and we'll be following those numbers very closely to see within the 28 days what's happened there, to see if some of those provisions can be lifted. But that just depends on how the numbers go. It's still too early to say just yet.
Thank you, everyone.
Thank you, everyone.